Hello, I'm David Wallace, founder of PV Reporter and our nonprofit sister organization, MPN Cancer Connection. I'm your host for today's Patients Are Asking program. We would like to thank our sponsors, GSK, Morphosis, Insight, AbbVie, and Pharma Essentia, for their support of today's program. We're very pleased to welcome MPN expert Dr. Angela Fleischman from UC Irvine.
Hi, everyone. Thank you so much, David, for this opportunity to talk with you today about some exciting topics. And as always, I love talking about anything to do with MPNs, so I'm excited about today.
Let's dive right in. How can a holistic approach that combines lifestyle changes, mental health support, and conventional medical care improve outcomes for MPN patients?
Okay, so that's a very good question, and I think that there's not necessarily a right answer to it. But from my perspective, I think it's very important to approach an MPN patient as a physician, as well as to approach your own health as an MPN patient in a holistic manner. At present, MPNs are classified as cancers. They weren't necessarily classified as cancers previously. And in some ways, I think that this does a disservice to patients by forcing them to approach their disease a little bit differently. So I would encourage patients to, instead of sort of classifying themselves as a cancer patient, classify themselves as somebody with a chronic disorder. So then that really allows the person to really look at their health holistically and to think about things that they can do to improve their health. We know that MPNs themselves, because of your JAK2 mutation or your calreticular mutation or whatever MPN driver mutation you may have, you do have an increased risk of getting blood clots and increased inflammation that's associated with the disease. And we know that in other chronic inflammatory diseases like cardiovascular disease, really lifestyle improvement is really helpful for better outcomes. So one could approach their MPN as more like a chronic inflammatory disorder where, adhering to a general healthy diet. Now, people always ask, oh, what am I supposed to eat? What am I not supposed to eat? I really think instead of focusing on specific foods to increase your platelet count or decrease your platelet count, or really, I don't think that's the appropriate approach. I think the appropriate approach is to look at your diet as a whole. I think it's most important what you're not eating than what you are eating, really focusing on whole grains, fresh fruits, fresh vegetables, minimizing unhealthy meats and packaged foods. But, it's sort of common sense. Eat healthy. I think exercise is also obviously very important for anyone, in particular in MPN where fatigue can be a big issue, that, paradoxically, if you feel really tired, then you go out and exercise, you feel more invigorated. So would highly encourage that. It's also important to have a healthy weight for anyone, but in particular for MPN patients. So I don't think that I'm saying anything that's really groundbreaking here, but really do want to emphasize that MPNs should be thought of as a chronic inflammatory disorder. And so it is of utmost importance for the patient to maximize their general health.
Okay. And I'd like to inject a comment on mental health support. So in the early years when I was diagnosed, I've had PV for 14 and a half years now and I'm doing well. But the early years were very, very difficult. And I sought assistance from a mental health counselor at our local cancer center. And that really helped me. And it was a service provided by the cancer center. I'm like, wow, I wonder how many people are aware that assistance is really out there. So I wonder if you could talk about that a little.
And thank you for that follow-up question, because I know, unfortunately, that was one aspect I didn't quite answer in your first question, that I think MPNs, the patients are a very unique set of patients because you have unique issues, because with an MPN, many times people are very healthy, but and can live a very full life, but there is always this sort of concern looming that it may progress to something more severe. And so that can really give people quite a lot of anxiety, and is something that is actually a real benefit for MPNs to be classified as a cancer, because that allows an MPN patient to take advantage of all of the resources, including mental health resources that are available for cancer patients. So I think that's a good aspect of MPN being classified as a cancer. So you might as well utilize the resources. Yes, I think it's very important, and to for anybody who has a chronic illness, in particular an MPN, to seek out some mental health. I mean, even if you think that you're managing your mental health well, I think you can always get better techniques on how to manage stress, how to be more mindful, from professionals. So I would highly encourage all MPN patients to seek out, or at least evaluate what's available to them and take advantage of those resources.
What potential challenges or risks are associated with the watch and wait approach for myelofibrosis treatment, essentially in community oncology settings?
Okay, so that's a very good question. So you're asking about watch and wait in particular for myelofibrosis.
Yes.
So I think with myelofibrosis treatment, it's very important to identify what the specific treatments are proven to do. So for example, JAK inhibitors are very good at reducing spleen size and improving symptoms. At the present time, our compilation of approved JAK inhibitors, as of today's date, really don't address significantly the anemia component. That may change in the near future, as well as we don't have significant, hard evidence about how JAK inhibitors change the natural progression. So I think you were trying to ask me, is there a negative to watch and wait? But I think my response is the opposite. Is for treatment, you really need to be well informed what the treatment is intended to do. So as a physician, I really I have many myelofibrosis who are on quote watch and wait, because I really look at each patient very carefully, whether or not a JAK inhibitor. I'm just going to talk about JAK inhibitors because that's what that's the main treatment that is available for myelofibrosis patients. Is a JAK inhibitor appropriate for that person? Obviously, if their main issue is a very large spleen and lots of symptoms, and they have robust blood counts, yes, of course, a JAK inhibitor is very appropriate. But if at the present time their main issue is anemia and maybe they don't have very many symptoms, then I don't feel impelled that a JAK inhibitor is appropriate for them at this point in time. Until, from my perspective, we have alternative therapies or have information on JAK inhibitors that they definitively change the natural history of the disease.
What do you think about the utilization of interferon for treating myelofibrosis patients?
Now, interferon alpha in all MPNs is a very unique medication in that in studies, interferon is really the only medication that can significantly reduce the JAK2 mutant cells, and in some patients bring it to below the level of detection. Now, interferon alpha, specifically the formulation of ropeg interferon, or called Besremi, is FDA approved in patients with polycythemia vera, and other formulations of interferon alpha, such as pegylated interferon alpha, or most commonly Pegasus, has been used what we say off-label. in PV, ET, as well as myelofibrosis for many years. And there are ongoing studies looking at interferon alpha and myelofibrosis. So with myelofibrosis, it's important to note that every myelofibrosis patient is very unique. So there isn't necessarily one medication that is appropriate for all myelofibrosis patients. But interferon in a select group of myelofibrosis patients may be an ideal medication, in particular for those patients who are really trying to do something to potentially change the natural history of their disease, or maybe if they have very early myelofibrosis, to blunt progression of myelofibrosis. So I think it's a little too premature to say that interferon alpha is good for all myelofibrosis patients, but in select patients, I think it is a very, very appropriate and beneficial medication, and has the benefits of potentially reducing the JAK2 percentage. And there are studies combining, and in the context of clinical trials, combining interferon with JAK inhibitors. That combination is not necessarily a mainstream combination at the present time, but potentially could be in the future.
Thank you, Doctor, for joining us today. And stay tuned for a word from our sponsors.
Okay, thank you very much.
Hello, everybody. My name is Meredith Manning. I work for Pharma Essentia, and I'm the president of the Americas. Pharma Essentia is a fully integrated, growing biotech company. And I wanted to really thank David for inviting us to join you all today. We are proud to sponsor MPN Cancer Connection, as we know it's such an important resource for the entire MPN community. Just to give you a little background, at Pharma Essentia, we've been an essential partner in the MPN community really for over 20 years. As you may know, we have an FDA product that was approved for PV back in November of 2021. And we would encourage you to learn more about the product, both the dosing, efficacy, and safety, and the profile of our product at pharmaessentia.com. I wanted to share with you that we have 2 clinical programs which are currently enrolling for patients. One is the Eclipse PV. This is a clinical study that we've started in the US and in Canada. And it's a really critically important study as we're looking at evaluating the new dosing regimen compared to our current dosing regimen, which is approved by the FDA. Our second clinical study is Exceed ET, and this is a clinical study also happening in the US and in Canada, and this evaluates the potential of a new investigational ET therapeutic. Information on the study can be found at eclipsepv.com and exceedet.com. Your stories and experience are what drive us every day to do more. I would like to spend a couple of minutes sharing with you some resources that we've been very dedicated to create over the past year and the past couple of months. So I'm really excited to share with you the first resource, which is called the PV Pod, Stories from the Marrow. This is a podcast that will feature voices from the PV community, both clinicians as well as patients, as well as other advocates. And hopefully we can get some caregivers in there to share their information. We've heard over and over again that it's really important to have forums like you're doing today in order to be able to connect with other patients, with other caregivers and clinicians to stay informed and feel really empowered to take action in whatever MPN that you might be experiencing. Second, I want to share with you that we have a resource which goes into PV specifically. It's called What's Next PV. This is an online resource to help you better understand areas in which you might be experiencing during your PV journey. So please visit what'snextpv.com and take a look. Finally, we know what's really critically important is as you talk to your care team about what treatment is right for you, it's really important that us as manufacturer provide you additional resources. So we have Pharma Essentia Source program. It is a resource for patients who have been prescribed a Pharma Essentia therapeutic or a Pharma Essentia treatment. The source provides personalized services, including access and payer navigation assistance. We look forward to continuing to advance treatments for even more blood cancers in the MPN space. I thank you profusely for your support and your partnership, and we are proud to stand alongside you in this powerful community. So thank you, David. Thank you, everybody, and warm best wishes to all of you. So thank you.
Hi, my name is Kristen Griffiths, and I work on the public affairs team at Insight focused on MPNs. I'm very pleased to be here today to represent Insight, and I would like to thank David and MPN Cancer Connection for having me and giving me a few moments to speak about our company and its commitments to patients. A little background on Insight. Insight is a Wilmington, Delaware-based biopharmaceutical company committed to making a difference in the lives of patients through scientific discovery. Rigorous science is at the core of everything that we do to develop, discover, and deliver novel medicines that will meet the serious medical needs in oncology and other diseases. We are committed to providing better outcomes to patients through the medicines that we develop and the education that we provide to support the community. One of our most important commitments is to ensure that the appropriate patients may have access to the medicines that they need. For this reason, we have developed a patient program called Insight Cares to help support patients and healthcare providers access their prescribed medication. For eligible patients, Insight Cares offers prescription drug verification, prior authorization support, free drug and copay assistance for those who qualify under the program's terms and conditions, as well as ongoing education and support from a representative. Patients who have concerns about access to their prescribed medication should contact Insight Cares for assistance. Information for patient access can be found at www.insightcares.com. Once again, that's insightcares.com. And we highly suggest that eligible patients enroll in Insight Cares even if you don't think you will need access initially. Circumstances can change, and if an eligible patient is enrolled, we will be able to provide the individual assistance more quickly if needed. Regarding clinical trials, we are currently enrolling in clinical trials for MPNs. If you're interested in clinical trials, please contact your healthcare provider. Detailed information about Insight's clinical trials can be found at insightclinicaltrials.com. Once again, that's insightclinicaltrials.com. We strive to enhance the patient community to integrate an authentic patient voice through our initiatives. Partnerships like the one we have with MPN Cancer Connection have really been key in helping us understand the unmet patient need and caregiver needs, including disease awareness, and also providing a true authentic voice in the MPN community through the materials that we create. We host a website called voicesofmpn.com where we provide access to MPN information, patient stories, access to information on MPN community events such as Facebook Live programs, patient meetings, podcasts, and also a symptom tracker. So I highly suggest that you check out voicesofmpn.com to see that information. And in closing, I just wanted to say thank you again so much for giving me a few moments to speak to you today. Programs like this allow Insight to utilize our resources to help improve the lives of individuals impacted most on the diseases in which we work. So thank you so much and have a great day.
Hello, my name is Elsa Lavita. I'm Director of Patient Advocacy at Morphosis. It is a pleasure to be here today, and thank you to David and the MPN Cancer Connection for the opportunity and partnership. Morphosis has one FDA-approved therapy, and our pipeline consists of investigational cancer medicines in mid and late-stage development. This includes pelabresib, our investigational BET inhibitor. Pelabresib is being investigated in the phase 2 MANIFEST study in combination with ruxolitinib, a JAK inhibitor, in patients with myelofibrosis and as a monotherapy in patients with myelofibrosis and essential thrombocytopenia. Pelabresib is also being investigated in the phase 3 MANIFEST-2 study in combination with ruxolitinib as a first-line treatment for myelofibrosis. Pelabresib is an investigational orally administered small molecule, or in other words, a pill, designed to inhibit the activity of a family of proteins called BET proteins. The BET family of proteins is an emerging potential therapeutic target that can modify the underlying drivers of disease in myelofibrosis. JAK inhibitors, by influencing the JAK-STAT pathway, have already been approved to treat myelofibrosis in intermediate and high-risk patients. Combining BET inhibition and JAK inhibition in preclinical studies suggests the potential for the two to act synergistically to alter the underlying disease process in myelofibrosis. MANIFEST-2 is a global, multi-center, double-blind, randomized study comparing pelabresib in combination with ruxolitinib versus placebo plus ruxolitinib in patients with myelofibrosis that have not been previously treated with a JAK inhibitor, otherwise known as JAK inhibitor naive. A double-blinded study is one where neither the patients nor the researcher knows which treatment the patients are receiving until the clinical trial is over. MANIFEST-2 has recently reached full enrollment and is no longer recruiting. More than 400 patients in MANIFEST-2 were randomly assigned to two groups of equal size. The first group is receiving pelabresib in combination with ruxolitinib, and the second group is receiving placebo plus ruxolitinib. Understanding that spleen enlargement reflects myelofibrosis disease activity and can cause significant pain and/or discomfort for patients, the primary endpoint of the MANIFEST-2 trial is the proportion of patients who achieve a 35% or greater reduction in spleen volume 24 weeks after starting treatment, known as SVR35. Since we know that people living with myelofibrosis can experience severe symptoms that may diminish their quality of life, we designed the study so that the key secondary endpoint of the MANIFEST-2 study is the proportion of patients achieving a 50% or greater improvement in the total symptom score, as measured by the Myelofibrosis Symptom Assessment Form version 4.0, 24 weeks after starting treatment, also known as TSS50. As we release data from the MANIFEST and MANIFEST-2 studies, we will work closely with the MPN Cancer Connection to ensure regular updates on our studies are shared. The top-line data from the MANIFEST-2 study will be available by the end of this year. As a reminder, pelabresib is an investigational new drug not approved by any regulatory authority, and there is no guarantee that it will be approved. At Morphosis, we are honored to work with patient advocacy groups like the MPN Cancer Connection serving the blood cancer community. Thank you so much for the opportunity to be here today.